So many people supplement with omega-3s, but did you know that most of the products on the shelves don't have the right ingredients for psychiatric use? So today, I'm going to share with you what to look out for when purchasing omega-3s, how to properly dose them, and then give you some reputable brands to check out. So the first thing I need you to know is that omega-3s are considered to be essential fatty acids. They're essential because your body cannot make them on its own. They have to be obtained from what you eat. Now, there are two types of omega-3s that I want you to know about, EPA and DHA, and supplements at stores will vary on the amount of EPA and DHA they contain. This is where people commonly go wrong, okay? You want to purchase an omega-3 supplement that has at least 2 to 3 times the amount of EPA to DHA, or those that are pure 100% EPA. The supplements that contain higher ratios of EPA have been shown to lead to a better response when treating things such as depression, ADHD, mood swings, and aggression. Anything other than this will likely be ineffective in treating your symptoms, period, okay? Now, dosing is going to be variable depending on your age. When we're talking about kids aged around 4 to 8 years old, I often recommend taking between 1,000 to 1,500 milligrams per day. Older kids can take up to 2,000 to 2,500 milligrams per day, while I've seen adults take anywhere between 3,000 to 5,000 milligrams per day. Generally, what we see is that patients will take their supplement multiple times per day with meals to get up to these ranges and to make it more tolerable. And it can take up to 6 weeks before benefits start to appear. So the most commonly reported side effects include fish burps and bad breath. And so choosing an enteric-coated or odor-neutral product can help with this, as well as refrigerating the capsules. And so some other side effects that I want you to know about include nausea, heartburn, diarrhea, rashes, and nosebleeds. Now for the big question, which brands are best? So let's start off with the kids first. Something to watch out for is that most gummy and chewable forms of omega-3s don't contain enough levels of fish oil, so the capsules and the liquids are generally better options. However, getting a kid to take a capsule when 1, they don't like swallowing pills, or 2, they refuse to experience the fish burps is nearly impossible. So there are 4 liquid products that kids interviewed by Attitude Magazine have tested and given their vote of approval for, and these are the ones that I commonly suggest for my patients. All links for these products talked about will be in the description below, okay? So the first product that I want you to know about is Barlean's Kids Omega Swirl. This is lemonade flavored and it has the taste and texture of a smoothie. And so it contains 720 milligrams of omega-3s per 2 teaspoons of servings. And all kids who took this loved it. The second is Carlson for Kids, and this is also lemon flavored. It contains 800 milligrams of omega-3s per half teaspoon serving, and the kids preferred to mix this with either chocolate milk or lemon yogurt. The third is Coromega Kids Omega-3 Squeeze, and these come in portable single-dose packets and contains 284 milligrams of omega-3s per 2.5 gram packet. And the kids noted that mixing it in a smoothie or in some yogurt helped improve the taste. The fourth product is Nordic Naturals Omega-3 Everescent. And kids like this one because it was fun. When you mix the powder with water, it creates fizzy bubbles as it dissolves. And these come in single serving packets and have the added benefit of vitamin D3. And so other than mixing it with water, you can also mix it with like lemonade or orange juice. Now, for kids who can take capsules, I often recommend the Purity Products Omega-369 Vegetarian Soft Gels. This is actually a fish-free option that is made from algae, flaxseed oils, and other plant-based sources, and this helps eliminate the dreaded fish burps. With adults, I always like to get the most bang for my buck, so my preference is to get a high concentration product that you only have to take once per day instead of multiple times per day. I also try to get ones that have been tested and approved by Consumer Lab. There's tons of options out there that will do the trick, but I'm going to tell you about the top 4 that I commonly suggest. So the first product, and one of my top favorites to know about, is GNC Triple Strength Fish Oil. This comes in a soft gel that is enteric coated. It provides 734 milligrams of EPA and 266 milligrams of DHA. The second one I want you to know about is one that is completely plant-based and is enteric coated. It's Omega via Ultra Concentrated Omega-3, and this is made up of 780 milligrams of EPA and 260 milligrams of DHA. The third one to know about is Carlson Elite EPA. This is one of the top EPA to DHA ratio omega-3 options out there. It contains 1,000 milligrams of EPA and only 16.5 milligrams of DHA. And then product number 4 to know about is Nordic Naturals Pro Omega, and this is a liquid that's composed of 1950 milligrams of EPA and 975 milligrams of DHA. Now remember, not everyone is going to want to take a supplement, and some people might prefer to just change up their diet instead. If this is your approach, then you're going to want to try to eat a 6-ounce serving of oily fish at least twice per week. And so these fish could include things such as salmon, herring, or anchovies. And then other dietary sources would include walnuts, flaxseed, edamame, fruits, and dark green vegetables. Just be aware though that these dietary sources often don't have enough EPA to match the clinical doses that we see with supplements. Now, if you're looking to learn more about natural treatment options, make sure to click that top video.